Okay, hi everyone, and happy February. Welcome to our February STEM Talks. This month's event is focused on the field of cancer and cancer care and research. They're going to hear from three wonderful speakers working in this field today. Before we get started, just some housekeeping. We have three panelists here today. We have Jenny, Martine, and Sunakshi. They all work at the University Health Network and are looking forward to speaking with you about what they do at UHN and what their roles entail. So you're going to hear from them first for 5 to 10 minutes each, and then we're going to have an open question period. If you have any questions, please put them in the chat, or you can use the Q&A box to ask your question, and we will get to them during the Q&A period. If you are here for the Certificate of Participation program, we are going to note your attendance using Zoom. So no need to do anything. You just have to make sure your first name and last name are spelled correctly and match what you used to sign up. And before we get started officially, Ornella is going to launch our little welcome poll. So this is just to say hi and check in, and you should see it pop up as a separate box on your screen. And I'm just going to give another 10 seconds while you answer the poll and then throw it on to our Certificate of Participation program while you respond. So if you are new here, we do offer this program called the Certificate of Participation program. And what it involves is youth who attend 7 eligible events between the period of September and June will get a certificate signed by senior UHN leadership to verify their participation in our program. If you are in the SHISM Health and Wellness program, you can also receive a medical terminology or lab practices certificate towards your SHISM requirements. And in terms of eligible events, they are usually our virtual events as well as our PA Day program. The virtual events take place after school at either 5 or 6 p.m. So you're able to attend after any extracurricular activities. So you can go to our website to sign up for this program and you can get a preview of what other virtual events we have coming up. You can also scan here, and Ornella will put the link in the chat very shortly, so you can click there if you need to. With that said, we're going to leave the poll up for a few more seconds, and I'm going to throw it to our first speaker for the day. So Jenny, feel free to take over whenever you're ready.
Okay, I think we're good to get going, and I hope everyone can see my screen. So thank you for joining us today. My name is Jenny, and I'm a clinical registered dietitian currently working at the Princess Margaret Cancer Center with UHN. So just to start off, a little bit of a background on myself. So, I actually grew up in London, Ontario, and you'll see later on in my education section as well that I actually completed my entirety of my education background in London as well. Um, a little fun fact too is that I guess after spending my entire life basically in London, I started my career in the middle of COVID. And that actually brought me out to Vancouver, BC, which is where I started my career as a clinical dietitian. Um, After kind of things settled, I decided to move closer to home, and that's where I landed. I'm coming up to my third year here at Princess Margaret, which is really amazing. Outside of work, some of my hobbies are I love to cook. I think it's part of the job too. I'm a big foodie. Something I picked up in Vancouver is that I love spending time outdoors. So during the wintertime, you'll catch me skiing. During the summertime, you'll catch me hiking. And you can see there's a photo of me hiking back in BC. And then I also love to boulder. So rock climbing is definitely one of my favorite hobbies as well. So, onto my educational background, I completed a 4-year honor specialization in nutrition and dietetics at Western University. So, that's a Bachelor of Science, it's 4 years. What's great about this program is that there are a lot of different pathways that you can take from here on out. There's food science, there's policy, there's family studies as well. But essentially, my interest was and my goal was to work in a hospital as a dietitian. So that brought me into completing a 1-year diploma in dietetic education and practical training at Brescia University College, which was affiliated with Western University. So that was a really great, about a year and a half program where it was coursework and as well as clinical work. And I did all my clinical placements at London Health Sciences. So the area that I currently work in, I currently specialize in malignant hematology, which is really just a fancy way of saying cancer of the blood. To tunnel it even further, I work in the lymphoma, myeloma, autologous stem cell transplant, and cell therapy programs at Princess Margaret. So I actually see patients that are admitted in hospital, as well as patients that are well enough receiving cancer treatment as an outpatient too. So my goal or my role in this area is to identify and address patients that are at risk of malnutrition in the acute care setting. So I'm looking at patient risk factors and getting involved if a patient is having trouble eating or maintaining their nutritional status. So the third point, optimizing nutrition to again ensure patients remain strong and really well nourished throughout treatment. The more well nourished a patient is throughout treatment, the better the outcomes are. So I don't actually have any current research projects ongoing, but I do have some ongoing projects that I'm hoping to work towards in the inpatient and outpatient setting. Um, I want to say that I'm still fairly new still leading up to my third year, but I'm getting into the groove of kind of identifying gaps and finding ways to troubleshoot those gaps. So one of my big projects right now is to develop new educational materials and resources for our patients and their families to streamline education and to alleviate any potential anxiety or stress that food may have on our patient population. I'm also working alongside a lovely group of dietitians, and we are working to implement malnutrition screening tools in the inpatient and outpatient settings. You can imagine Princess Margaret gets a large handful of patients yearly, and we definitely want to make sure that anyone that is at potential risk of losing weight or becoming malnourished is being flagged and seen by a dietitian promptly. So a quick week in my life. Because it's inpatient and outpatient, it does vary, but an idea of what I do overall, I typically will screen my patients daily and any new admissions that might come into the hospital if for high risk of malnutrition, weight loss, and poor intake. So usually what I'm looking at is has a patient lost weight recently? Are they presenting with symptoms that may be causing them difficulty eating. So I will complete a nutrition assessment where I'm asking them a series of questions. So for example, do they have diarrhea? Can any concerns chewing and swallowing? Do they have nausea or vomiting? All symptoms that could definitely impact their ability to eat properly. From there, I also like to collect a bit of a diet history just to get to know how patients are eating prior to their treatment and prior to their admission. From there, depending on what I gather and the information that I gather, I implement nutrition intervention. So a lot of the time it is optimizing the diet in hospital. So providing supplements like Ensure or Boost. I don't know if any of you have heard of that. Or just giving some suggestions of high protein, high calorie food choices that they can focus on to prevent any or to decrease the risk of malnutrition or unintentional weight loss in hospital. Another really interesting intervention would be nutrition support. So that could be tube feeding. So that would be, for example, if a patient can't eat orally, then we would consider putting a tube into their nose, down to their stomach to help with feeding to ensure that they don't go an X amount of time without proper nutrition. And there, again, a lot of factors that could lead towards that decision after my assessment. And then finally, sometimes my intervention could just be education. If a patient is newly diagnosed with cancer and they have a billion questions on what to eat or what to do, and a lot of these patients are quite, they're information seeking. So they'll do a quick Google search, and we know Google is maybe not the most reliable source. So I do a lot of overall diet education and maybe some myth busting with my patients as well. I attend interdisciplinary rounds and collaborate with allied health. So my job cannot be done without collaboration and communication amongst the team, nurse practitioners, physician assistants, and the doctors. So we meet daily to speak about the patients as well. I also attend webinars and lectures to further my learning. So new standards of practices are always coming up. So it's good to stay updated. And finally, I'm actually taking on a dietetics student at Current from the University of Toronto. So I do work and precept future dietitians as well. So the importance of the job and the research in the field. So essentially, like I mentioned, nutrition plays an important role in cancer treatment. It helps manage side effects, support immune systems, and increases the body's ability to heal and recover throughout treatments. I often tell my patients that an expensive car wouldn't run without gas. And our bodies definitely do not run without proper nutrition. So it is very important to highlight that to them. So it's really important to have kind of a point person, kind of a nutrition champion, right? In order to educate and empower patients to make informed decisions about their nutrition and food choices moving forwards with treatment. I like to ask myself often, like, what are my future goals? And I think the three that come up are definitely spreading malnutrition awareness, advocating for standardized nutrition screening, and having more of a proactive and preventative approach when it comes to nutrition rather than being reactive when, for example, patients already lost 10 pounds and I'm getting involved just then. I feel like having a more proactive approach is really important. And finally, why I chose this career. I've always really had an interest in healthcare, even in elementary school and high school. I but I didn't really know where I wanted to go with that. It wasn't until I took a grade 12 nutrition course where I was like, oh, okay, I can actually apply my interest in healthcare and my interest in science with something that I also love on the side, food and nutrition. So I really did find a career that combined both my love of food and cooking with science and being able to help my patients eat and stay nourished is very, very rewarding. Again, I wanted to be a reliable source for the healthcare team, patients, and their families. I really, again, it is a very rewarding role because I get to see firsthand my interventions in play, and it's very rewarding to see patients succeed and maintain their weight or gain weight while on treatment. And again, through this role at Princess Margaret, I have the opportunity to meet a lot of different people from different backgrounds and cultures and stories. So I really do love that aspect of being a part of the treatment care team as well. So yeah, that's a little bit about me. So I can probably pass it on to the next speaker.
Well, thank you for this invite. So my name is Martina Putz, and I'm currently a professor at the Faculty of Nursing at the University of Toronto, and I'm a clinician scientist at the Department of Supportive Care in Princess Margaret Cancer Center. And so a little bit about me. I'm an immigrant to Canada. I am from Amsterdam, the Netherlands originally, and this is my family. This summer, we went to see my mom in Paris. I came to Montreal in 2006 after I finished my PhD at the University of Amsterdam. And so I've been working at the University of Toronto since 2009 and at UHN since 2015. And with my kids, we enjoy swimming, reading, hiking, and skiing. In terms of my education, I did quite a lot because I didn't in the beginning. I knew immediately what I wanted. So I started with a bachelor in nursing. I was always interested in medical sciences and biomedical sciences, but I didn't see myself in a lab and with microscopes and things like that because I knew I had to do more with my hands and talk to people. So that's how I got into my Bachelor of Nursing at the University of Applied Sciences in Amsterdam, which is really a professional training. It's not a Bachelor of Science. So then in the Netherlands, I switched to do a master in health sciences. And so I did a major in healthcare innovation where I had to do research. And I really discovered that I really liked research. As a nurse, I hadn't really been involved and I didn't quite know what the concept was. But then in my master, where I had to do a thesis, I really enjoyed it. So after my master in health sciences, I did my PhD at the Faculty of Medicine. And you see, this is the picture in the Netherlands. It's slightly different in Canada, where this is the final defense, where we have professors from different universities. And one of these professors sitting here was Howard Bergman, professor in geriatrics from McGill University, who invited me to come do a year postdoctoral fellowship, which is additional training work after you finish your PhD. And so even though I'd never been in Canada, the idea of going a year abroad sounded very exciting. So off I went to McGill University, and I was located 1 day a week at McGill University at the Department of Epidemiology and Biostatistics. And the other 4 days I was in the Jewish General Hospital, where I collected all my study data and analyzed it. And during my PhD, I had a professor. I had two supervisors. One was a clinician and one was a professor in biostatistics. And she told me, you can't really be my PhD student without doing a master or something in epidemiology. You really need that background. So during my PhD, I also did the master's program in epidemiology. And so that's how I came to Canada. And after 3 years at McGill, I applied at U of T, and I've been here since. And so the topic of my research is really older adults. And why older adults? I always, we had my grandma living with us for a while. And I've always in nursing worked with older adults all my life. And so my research was logically that it focused on older adults. And my research really focuses, it's not in the lab, like we have microscopes and things like that, but it's really more supportive care. What can we do to help older adults improve or maintain their ability to do activities that are important to them? And so we do several studies with the older adult team at Princess Margaret. And this is not my picture for my study, but we're doing currently a study with exercise where we really trying to help when older adults start treatment. And the majority of cancer patients in Canada are older adults. Often that impacts their functioning, how well they're able to do their daily activities. They might decline in their ability to do their household activities, how well they're walking and things like that. So we're really trying to improve that during the treatment with various kinds of interventions. So this is an exercise, chair-based exercise study, but you can see the picture. And we're doing one currently with chair-based exercises via Zoom, so that there's no extra appointments to make it easier for all the adults to participate at home. Another project, which is a more newer area, is really focusing on cancer in racialized older adults. We know from the United States that those who are racialized, those who are older, and those who are female experience worse outcome due to racism, ageism, and sexism. And so we know very little about that in Canada. And so that is what we are doing in this Nuance project, where we're really trying to understand the inequities in cancer treatment access and cancer treatment outcomes in older racialized Canadians. And so it's a very big project. It's still ongoing, but we're interviewing and doing surveys with older adults to really get their experiences. Did they experience any delays in accessing the cancer treatment? Did they feel they were discriminated when accessing cancer care? And we're also speaking to family physicians, to oncologists, to stakeholders, policymakers, those who make decisions about cancer treatment, to really understand it from all aspects. And then the next step in that project was really, it will be to really bring everyone together and discuss what are potential solutions. Because even though we don't collect race data in Canada as we do in the US, it would be not hard to think that maybe in Canada we also have, we know we have ageism, but we probably also have similar racism and sexism happening. So we're really trying to understand from people from all the different groups that are important to this project, to understand their experiences and to discuss together how we can make it better for racialized older adults to access cancer treatment and their experiences. So a week in my life, this semester I'm quite busy. I am teaching master and PhD students, so in the nursing program. So for master students, I teach the Master of Clinical Nursing. So those are nurses already. We're trying to become clinical nurse specialists, which is my role at Princess Margaret. And then as well, PhD students, teaching them research methods. I'm supervising students at the moment. I have 6 doctoral students, 1 MN students, and 6 undergraduate students, and 1 postdoc. So I supervise students with their own research projects. I supervise students who are interested in my projects, who I just had a nurse practitioner who wrote a first paper with the data and things like that. So that's very rewarding to supervise students from all different levels. And I'm always learning so much from someone else's perspectives. I'm also meeting with patients in the hospital because, as I mentioned, we do clinical intervention. So in two of the studies, we do a detailed health assessment, which we call geriatric assessment. So we meet with the patients and go over how they're currently doing and how we can best support them during the treatment. So that is what I do. As I said, we do the exercise classes over Zoom twice a week for our participants. And as a faculty member here at the Faculty of Nursing, I have different committees I'm involved in and things like that to keep the university as a whole running. And of course, I do my research, such as writing papers and things like that. So it keeps me busy the whole week. And so why I chose this career, I always loved working with older people. And so I started with nursing because at the end of high school, I didn't really have a clear idea of what I wanted to do. And of course, with the shortage of nurses, which was 30 years ago, the same thing. It's like, oh, try nursing and then you have something to start. And as I did it, I chose the older adult stream because in the Netherlands at the time you had to choose a stream. And I've always enjoyed working with older adults. And so as I did each different education program, I learned so much more skills. And at the end of my master, I really enjoyed research. And I thought this is something what I can do. And I really like that in the research, in the research area, you can choose what to focus on because it's really with the geriatrician, which I'm closely collaborate, we can really brainstorm together and what should be the next research project or what do we think is needed. But also you see, we get thank you letters and notes and cards for participants in the study for thanking us for taking an interest and trying to help them and things like that. So I find that that is very rewarding, that at the end of the day, you have done something meaningful, whether it's supervising your student or being part of a clinical team. And then I would like to give the word to the next speaker.
So hi, everyone. My name is Sonakshi Chaudhary. I'm a clinical research manager here at Princess Margaret Cancer Center at UHN. I hold two roles. I'm the clinical research manager at the surgical oncology department, specifically in the urology field. And I'm also manager of McKinsey Biobank, which is one of the biobanks that fall under UHN Biospecimen Services. So a little bit about myself. I'm originally from India. I grew up in New Delhi, India. I moved to the USA in 2006, and most of my education is actually from United States. I moved to Canada back in 2020 during COVID and for a job opportunity. I've been working at Princess Margaret Cancer Center for about close to 3 years now. In terms of my extracurricular activities, I enjoy reading, dancing, hiking, and recently I'm trying my hand at golf and I'm trying to do my best. All right, so my education and training, my undergraduate was in biology with the focus in pre-medicine from Warburg College. After that, I did my Master's of Science in Molecular and Cellular Biology, which was from Brandeis University. I had a very strong focus in pre-medicine and wanting to become a doctor. And hence, I ended up doing an undergraduate in biology. And during my undergrad, I was introduced to a summer research project, which focused on breast cancer. And that's how I got exposure to the research and the science side of things rather than the medical side. That shifted my interest and focus into research from medicine. And my another degree is Master of Science in Tumor Biology, which is from Georgetown University. And I'm also hold a certification for ACRP, which is essentially a clinical research professional certification. All right, so my scope of work and the field that my role is in is, of course, in clinical research. So what is clinical research? Essentially, it's simple terms, it's the study of health and disease in people. Under clinical research, we specifically, I work with cancer research, and the overall themes that we focus on our research projects is on prevention, diagnosis, and treatment, specifically in urologic cancers, for example, prostate cancer. So it's why clinical research matters. It leads to medical breakthroughs. It helps improve patient survival rates and quality of life. And, it helps scientists learn more about, the specific diseases and how to fight them. So my scope of work is around these similar themes. I oversee and manage the clinical trials that we have within our team that focuses on prostate cancer. We also have several research study projects that we conduct within our team that are focused on early detection of prostate cancer, the treatments, as well as we have a biobanking of cancer samples. And we have very heavy focus on health equity research as well, which I'm going to talk next about. So health equity research is one of our main topics of research within our team. I oversee the health equity project, essentially, which we are looking for is we are trying to improve prostate cancer outcomes in some of the high risk populations, essentially the populations which are at a high risk of getting diagnosed with prostate cancer. And we are trying to look at the genetics as well as the follow-up care, the healthcare within the prostate cancer field, and as well as listening to communities. And health equity, for I think everyone on the call might be aware of what health equity means, but in simple terms, it really just comes down to having that everyone has a fair and just opportunity to be as healthy as possible and have access to the healthcare services. So the four main areas that we look at is the genetics, as I mentioned, that is associated with, the high-risk populations that are getting that prostate cancer. We also do a traceback, which is essentially we do genetic testing, and then we return the genetic results back to the patients, and we also provide genetic counseling to the patients and the families. We have an educational program, for primary care physicians, which focuses on prostate cancer awareness, especially in the high-risk populations. And then we have a community outreach initiative, which is focusing on bringing the services directly to the communities. So PSA Detect and Protect Outreach Clinic is one of the clinics which we have recently launched, and we go into communities and offer free PSA testing. And one of the other research that I'm involved in is biobanking. I wanted to introduce this as this is one of the areas which not many are familiar with. So what is biobanking? It essentially is a collection, storage, and management of any biological samples. It could be blood, it could be tissue, it could be the processed samples like DNA for future research. And currently we have two biobanks within our team. There is a McCain-GU biobank, which focuses on specifically prostate cancer and other urology cancers. And then we have Princess Margaret Cancer Biobank, which focuses on collecting cancer samples from other cancer sites as well. So essentially the aim of having a biobank is that we have and collect all these samples that can act as an invaluable resource for internal researchers as well as external researchers, and to understand the cancer biology, genetic mutation, and essentially help in any cancer research going forward, which will ultimately help the patients in turn. All right, so a week in life of a clinical research manager. Essentially, it involves, oversight of the clinical trials and the research projects that we have, and it also involves oversight of the patient recruitment, ensuring that all the research projects and trials are being done as ethically as possible and keeping patient as in the center and important part of all the research. There is, of course, the regulatory piece as ensuring that all the processes are being followed for all the clinical trials. There's also a lot of external and internal client coordination. There are a lot of meetings that happen, with the outside PIs, with the internal PIs, nurses, as well as other service providers, and making sure that there is coordination and the project is moving timely forward. Of course, team leadership and training. The clinical research manager is a leadership role, so there is oversight of the other staff members, and as well as ensuring that they are fully trained. There is a lot of strategy planning. So what are our future goals? Where does our team and the department moves together towards the mission and the values that we establish, and looking for, of course, continuous improvement, looking at the urology research, what's coming up new, and how we can improve the services that we provide essentially to the patients. So the importance, of the job or research and that I currently hold, which is within clinical research, is overall, finding better treatments. It all comes down to saving lives and, discovering new and improved ways to treat cancer. And the trials that we do, the research projects we do, which we conduct within our team, have essentially the main goal is these, and then helping patients, of course, live longer, trying to focus more on early detection and early diagnosis of prostate cancer specifically, and then, in turn, advancing science for the future. Every study and every research project that we do, even the biobanks that we have set up, it's about helping the scientists learn more about cancer and bringing us hopefully closer to a cure, and helping the future generations. So why I chose this career, as I mentioned earlier, I started with my journey in undergrad in pre-medicine. I wanted to become a doctor, but this one summer fine day, I ended up getting introduced to breast cancer research, and I worked on a research project that looked at cells, and there was this whole new world that opened up, and clinical research was one of the fields where I was able to still hold to my passion of working directly with the patients, having a direct impact to the patients, but at the same time maintain the research side of things and keep my creativity and interest going. So that's all from my side, and I'm going to pass it over to Trishana.
Thank you, Sonakshi. That was great. And you actually answered one of the biggest questions of why research. So that was perfect. But with that said, maybe the first question we can start with is kind of something you can all answer. And students are just wondering about how you deal with working in the field of cancer care and research. They recognize that, it can be a heavy subject, or some days might be harder than others. So they're just wondering, how do you manage that? And maybe we'll go in order of speakers. So Jenny, do you mind answering first?
Yeah, so it's a really good question. And it's valid, right? It is a tough area to work in. I think for me, surrounding yourself, like I mentioned, I have an excellent team, so I'm not just kind of shouldering it all on my own also. So I think I'm very lucky to have an excellent team of allied health physicians as well as other dietitians to bounce ideas off. And if I'm having a bad day, like maybe chatting about it with the rest of my team members, so we can all kind of decompress a bit. On the side, though, I do definitely try to keep up with my hobbies outside of work. So it's nice to kind of keep myself busy too. So it's all about that work-life balance for me.
Thank you. And Martine, what about you?
I think there is good and bad things. Some days don't go as well as Jenny said, and then it's nice to have a team, and we have an older adult team, and research you never do alone, so there's always someone you can discuss about. But we also see a lot of positive things, because you can make a big impact if you help patients get better care, or support them during their journey, and things like that. So I think that's important, and no one lives forever. That is part of life, and particularly in your nursing training, you're very much aware of that. And being able to contribute, that they can live their life as best and fully as possible, I think is gives you satisfaction that you're really trying make a meaningful impact. And with your research, you can make an impact. And some days are not good days, and other days you have a student that graduates or has a first author paper, and it's a great day. So I think it's every job will have its ups and downs, but I think the teamwork in research is really very important to have that balance.
Thank you, Martina. What about you, Sonakshi?
I think I echo what Jenny and Martine mentioned, and I would just like to add, it all comes down to, I think, acknowledging the feelings that you feel while you are in the field and in the roles that we all hold. So, and if you're not your best self, you're not showing up at your best, for the patients. So it really just come down to acknowledging those feelings. And I take the time when I need that I need to take a step back. I ensure that I am at my best, and maintaining the work-life balance, which the team that we work for, they helps us achieve that. So yeah.
Thank you. And you said work-life balance. I see a chat question. How many hours are each of you working each day? Jenny, do you want to go first again?
Yeah, sure. I work 40-hour days, so I'm usually like 8 to 4 every single day, Monday to Friday.
Martine, what about you?
Probably too many hours, but that is because this semester I'm teaching 2 courses, and with all my other stuff, that makes it a busier semester. It's up and down. It's summer, it's more quiet because you're not teaching and things like that. So then it's less hours, but next month is CHR grant deadline. So you have to get your next grant in for your next research project. So that's always a bit of a scramble.
And Sonakshi, what about you?
I think similar to Jenny, I have a 40-hour week. But because of the nature of my role and the community outreach initiatives that we do, I do end up working on the weekends if we do have an event, which I'm always very excited to, and that doesn't feel like work. But yeah, a regular work week, I would say 40 hours.
Thank you. And this next question, I'm not sure if it's specific to anyone, but they're asking, they've noticed that a lot of people who have gotten cancer get it again later in life. Is this backed up by science? Why does this happen? Does anyone want to try answering that?
As you age, you get a higher risk of cancer because older age is the #1 risk factor for cancer. So regardless of everything else you've done in your life, just age is the biggest risk factor for cancer. And in Canada, we see that 70% of newly diagnosed cancers are in the population 65 years and over. So if you live long enough, you have a risk of cancer.
Thank you, Martine. And I think this next question might be for Jenny. So when you say that you're developing educational resources for patients, did you mean creating a guideline or some sort of program like a special diet?
Thank you for the question. So for example, the educational resource that I'm currently developing are for patients that are receiving a autologous stem cell transplant. So there are dietary requirements for these patients. For example, they do need to follow food safety guidelines because they're immunocompromised, but also they need to follow a high protein, high calorie diet. So this resource essentially is just listing out some examples of high protein, high calorie foods that they can choose from, as well as letting them know maybe some more unsafe foods that they should be avoiding. I'm not really developing any specific meal plans or exact diets that patients need to follow, but more so broadening their knowledge so that they can make informed decisions themselves. So, yeah.
Thank you, Jenny. I see a question for Sonakshi. What is your role specifically called?
So my role is a clinical research manager.
And then I think the follow-up question from someone else is they're just a little confused about how equity is showed in the Health Equity Project, or what exactly that means and how you're ensuring equity. Do you mind expanding?
So for the research project that we are focusing on, so we are focusing specifically the high-risk population, is essentially Black men. Black men have a high risk of prostate cancer. And we are trying to look at the genetics and as well as offering the genetic testing to the patients and have an option of providing those results to the families as well, so that they could be warned earlier that there is a genetic risk associated. And then the second, which is the PSA clinic, we are taking the resources directly to the communities where some individuals who don't have access to PSA testing and are not able to come directly to the hospitals and it is difficult for them, we are going to them and offering the testing, so that everyone has an equal chance of getting tested.
Thank you. And then I have a question here for Jenny. What does nutritional research look like? Maybe surveys or sampling? They're trying to understand what that means.
So thank you for your question. I don't know if I'm the best to speak on this. I haven't done research in a minute, but it's very similar to any other research question or project. So you're correct. Oftentimes it will be kind of surveying and sampling depending on the research question. When I was in school and I was doing research, I would do surveys, collecting data and information. So for example, one of my research projects was essentially I needed to gather diet recalls from our patient population. So it was a lot of surveying, calling, and gathering the information that the researcher was looking for. So yes, it's very similar to how other research would be framed as well.
Thank you, Jenny. And then I think this question is also about research, but for Martine this time. What kind of research do you do? Do you write reports? What does research look like for you?
So I do write research reports, research papers. So I do interventional studies. So right now I'm involved in two interventional studies. So one was the chair-based exercise where we're recruiting patients at Princess Margaret and Sunnybrook who are older, 65 years and over, and starting a new treatment, whether it's chemotherapy or immunotherapy for their cancer. And we are doing a comprehensive health assessment, and then we make recommendations. Have they had previous falls? What can we do to reduce their fall risk, to optimize the medication? Do they need a dietitian? We always screen for nutrition and refer them. So to help support them during the treatment, because we know the majority of patients is older, and over the age of 65, 1 in 3 older adults will fall already. And so cancer and its treatment might increase the fall risk. And we know that about 1 in 2 older adults experiences decline in their function, so their ability to do daily activities well during the treatment. And so we're doing chair-based exercises where the patient is at home. We give them an iPad if they need them, and then we are doing all kinds of strengthening and cardio exercises to prevent that they start falling during the treatment and to prevent that they decline during treatment. So that is one of the studies. The Nuance project is really to understand, and from their perspective, from older racialized populations, to really understand what they think is the problem and what they think should be the solutions. What is happening in Canada? So that is a cross-Canadian study, and the survey has been translated in 16 languages and things like that. And as Sunatski was saying, we're going in the community as well to try to find patients to hear their experiences, and because we really need to know the lived experience to know what should be changing. So that is another project. I'm also involved with Dr. Alibai, the geriatrician, on a study where we're using remote symptom monitoring and geriatric assessment, so the detailed health assessment. So that is really a technique. We know that older adults get the treatment in the hospitals, but typically the side effects of the treatment, such as nausea, vomiting, diarrhea, will occur at home. And so can we be proactive and use digital health to do questions on a telephone, a smartphone, every day, and see if the patient is declining, if increasing symptoms or a high level of symptom burden, with nurses' phone calls to see if we can manage it over the phone before it becomes such a big problem and they need to seek help in the emergency department and things like that. Could that help keep patients out of the emergency department and more proactive management of side effects during the treatment? So it's all in the supportive care area. I don't investigate new treatments or anything like that. But for older adults that are starting treatment, what are the things we can do to support older adults being as well as possible during and after the treatment?
Thank you. And I think that clarified someone asked about the cure, but I don't think anyone here today is working on that aspect of cancer research or care. I see a question here. Is it possible to have a gene mutation that can make you susceptible to all or a multitude of different cancers in different parts of the bodies? And they're asking anyone here. So in general, would any of you say, is there a gene mutation that you know of that maybe makes people generally more susceptible to cancer? Or is it lifestyle, or is there something else? What would you say to that? I'm seeing.
I know there are genes that make your risk higher, but this is not my area of research, so I can't really say anything about it. But there are certain genes, and I know that they look for a diagnosis too to see if patients have certain mutations, because knowing if you have certain mutations can also help with selecting what is the right treatment for you in the area of targeted and personalized medicine. And of course, we know lifestyle has an impact on your cancer risk. So the healthier you live, food and vegetable intake and things like that, we all know that is associated with a reduction in your cancer risk. Exercising a lot is healthy for you. So lifestyle, definitely a healthy lifestyle is associated with lowering your cancer risk.
Thank you. I think Sonakshi wanted to add on to that.
Yeah, I think I would add the same. I'm not a geneticist. Essentially, those are the individuals who look at genetics more in detail. But similar to what Martin said, that there are certain gene mutations that put certain individuals at high risk of developing that particular cancer. And if that gene mutation is present, then it is a hereditary risk, essentially, that it can be passed on to the generation. So it's very important. I think genetics and genetics-based research is gaining a lot of steam, and it's being looked into more and more detail. But they are specific to each cancer. There is, to what that gene mutation would look like.
Thank you. And I know we are getting to our last 10 minutes, so I'm going to try and combine some questions. A lot of questions are just asking about what you did to get to where you are now. Did you volunteer? What did you do in high school maybe to help spark this interest in science or, your current field? Would you mind each answering maybe kind of any advice for a high school student and how that helped you get to where you are now?
I guess I'll go first if we're going in order. During high school, so funny enough, I wanted to take an elective course and I really wasn't sure what. And it was the grade 12 food and nutrition course that was under kind of like the family studies umbrella that kind of was my intro to nutrition. I've always, again, throughout high school loved cooking, but didn't know that something like this had existed. So I did the grade 12 course, loved it. And then my teacher at the time actually introduced me to the program at Western and Brescia, and that's how I kind of did a little bit more research, looked into sort of what the program entailed, and I thought it was a really good fit. From there, a little bit of volunteering, I would say, with, for example, other schools. I also knew someone that was in the nutrition program, so I reached out to them just to get a kind of day-by-day play of how things go and like the career aspects, of course. So definitely, if you have an interest, I would just say go for it, take a class, see if you like it, and connect with your teachers to see if they have additional resources too.
I think that's a good segue to Martine, who is also a professor. But Martine, how did you kind of figure that out?
Well, I never really had a clear plan. In high school, and I did my high school in the Netherlands, so the system is slightly different. But I did a lot of do days for girls. I don't know. I know we have them in Canada too, because I didn't know what I wanted to study, and I liked biomedical sciences, things like that. So a lot of universities have open houses, open days, and some of them have an open day for girls, particularly in the STEM areas to attract girls. So I did a lot of those days because you got the day off of high school classes, and I really enjoyed it. So I did the day of dentistry school, and then you had to drill on a fake head and things like that. And like, oh my gosh, I could never do this in real life. So doing all these different days, do days, and I don't know exactly how you call them, but that really helped for me to see what I liked and don't like, and going to the different universities and seeing it's also the atmosphere, because I went to some universities and I thought, oh my gosh, this is not me. Like the whole atmosphere around it and things like that, I didn't like. So I think you have to go and see what you like and don't like. And if you don't have a clear idea like me, then just try all the different open houses and do days and just take a friend and go together and make a fun day out of it and discover, because I had no idea of half the studies that was out there when we were doing these days. And I think I don't have parents that went to university or anything like that. So I didn't have family members telling me, oh, you have this and that. We just went and saw all the different days and see what there was in terms of options.
Thank you, Martine. And Sonakshi, what about you?
So I think for me, and it's coincidence that Martin mentioned that during her high school and education years, she wasn't didn't have a clear plan. I, on the other hand, had a very clear plan. I had a grandfather who was a doctor, and I was always very fascinated, looking at the cells under the microscope in high school, and I knew that I wanted to become a doctor. I wanted to go that path. And, so during high school, visiting hospitals, I'm trying to see what nurses and doctors do and, shadowing them essentially. However, while I was on a very strong path to become a doctor, as now you all know, that I ended up in clinical research. So, so it's essentially, you never know where you get that inspiration from, and what new field you come across. So I think keeping an open mind, having a set plan or not having a set plan, I think I don't know how important that is, but having an open mind, on learning, and giving yourself opportunities to talk to people, and utilizing the UHN STEM Pathways platform and attending these webinars, and trying to volunteer and figure out different areas. Just like it's okay to take a risk. It's okay to find out more about new areas and see where and what you want to do when you're in high school. Time is really in your favor. So you have that opportunity.
Thank you. I think that was great advice from all three panelists. Because we're short on time, maybe we'll end on this last question about what is the most surprising thing you've learned about cancer in your career so far? And maybe we'll go in order again. Jenny, do you want to go first?
That is a very good question because I feel like I'm constantly learning day to day. Um, Something interesting that I've learned. I don't I don't know if I have like an exact answer to this, but I think something that I've really cherished and really learned from this position is how everyone works together in cancer. Like it's not just the doctors, it's not just the like research also. Like lots of my patients do clinical trials too, right? This is a whole hub of people, including the patients and the families. Like I love how engaged families are. I love how engaged the patients are and how much they want to direct their care to. So something I guess it's not interesting necessarily to say like or innovative, but something that I've learned working in this field that I found really amazing is that everyone has each other's backs and it's like a fine, well-oiled machine. It doesn't always go perfectly, but we're all kind of on the same boat. And I think that's really amazing. I don't think you'll be able to find that in many places. So it is really special, I find.
Thank you. And Martine, what about you?
I think more in health research and healthcare in general, things are changing so fast and compared to when I did my nursing training 30 years ago, like it was one disease. Now we have so many different diseases, different treatments and things like that for all the different diseases, whether it's cancer or diabetes and things like that. So I think it's working in healthcare, whether it's clinician or researcher, things keep changing and you keep learning and you keep having new challenges and you can keep contributing with new ideas and trying new solutions. I think that is what it's not like when you finish school, it's not like 40 years of the same thing you do in your career. It's always changing and you're always learning. And I think that's what I enjoy about being in healthcare and research.
Thank you. And what about you, Sonakshi?
I think, understanding a bit more about cancer biology, over the years and taking those courses, I think cancer in itself is always been fascinating to me, and essentially, like getting to like a really cellular level, and when a tiny, you know, protein or something here and there, and the cancer can invade. So the biology of cancer, and then even to date, like we keep finding new things about cancer, how it spreads, how it manipulates something within the body and make it work to its advantage. So that is something that I think has always kept me curious, but at the same time, it is also the reason why it makes this disease very deadly. So it's kind of, that yin and yang kind of going for me in there. But another thing that I've seen in my role is the holistic care, the overall care for a cancer patient that comes together. It's where, a few years back, it was just focus on the disease. Now it's more focus on the patient, and, all the care from different areas and what the patient needs, in their journey when they're battling with this disease. So, yeah.
I think that's a nice full circle answer. We have Jenny here too. We have, different kinds of people supporting cancer care and research at Princess Margaret and UHN. With that said, we are almost at the end, so I just want to quickly thank our panelists so much. It sounds like you're all very busy people, so we really appreciate you making the time to be here and share about your lives and your career journeys. While we wrap up, Ornella is going to launch a poll for students. Just a reminder, if you are here for the certificate program, you do need to answer that poll, so you should see a pop-up on your screen. And I'm going to get started with our wrap-up slides. So if this is your first time coming here and you're not really sure about what we do or who UHN STEM Pathways is, you can scan the QR code here or go to the link listed up on the screen to learn more about our program on our website. We are UHN's official youth outreach program when we provide free programming for youth in elementary school and high school to kind of explore their interests in STEM. If you have any questions about any of that, you can also send us an email. And if you want to kind of get a better idea of what we're doing or follow along, feel free to follow us on social media.